Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to the Nourishing Traditions, and today I'm going to talk about gum diseases. So we know that there is some kind of a connection between heart diseases and the oral bacteria, because when they've done autopsies on these arteries to see exactly, even on live people, when they've cleaned them out to see the culture, what's in there, and they've predominantly seen oral bacteria. So how is oral bacteria getting into our arteries, and then it's getting into the bloodstream and it gets down there? So if you've got a gum disease and there are higher number of anaerobes that are causing this problem, they've shown that on a patient that bleeds easily, that when you just lightly probe the bleed, there is a high number just by that process of bacteria that causes harm to the heart arteries in their mouth or from their mouth. And then when they've looked at the species and cultured them, they see Fusobacterium nucleatum, which comes from the mouth. It's the most dominant bacteria in our entire mouth. At 500 species, it's the most dominant, and that was in high numbers. And the other one was Streptococci. All the streptococcal species, again, they come from where? From the mouth. And a lot of times that plaque is the reason that you have heart disease. And in many other presentations we're going to do on cardiovascular health, inshallah, we will see the buggies which are causing the inflammation, infecting your plumbing, the kind of the same bugs. And the injuries that are happening day after day, month after month, year after year, and then plaque is coming in sort of protect and to help compensate in a very stressed out area. People really need to understand that this is the cause. Well, what is the Western medicine mostly about? It's about symptoms, right? So what's your symptoms? You've got this problem, here's a pill to fix it, and that's what statin drugs are. You could argue statins do some effective work, they do, but at what cost? And are you solving the functional problem? The functional medicine is all about, let's get to the source. The source is your mouth, your bacterial count. Now, what's going on? Are you acidic? Is your diet poor? Do you have too much sugar? What is it? So if we get to that and fix it, then all of the rest of this is easy. Diet changes, home care changes, those plaques will actually decrease in size, the lumen will get larger, so we can actually correct this even in the middle of the process just by changing our oral habits. You don't need pills. And by the way, they've shown this into many studies. Even if somebody had already got their arteries filled with plaque, but they changed and they do things that we're going to discuss right now, it helps them a lot. So a lot of people, they say that leaky gut, they complain of leaky gut, and the contamination from the mouth and the pollution from the mouth is spilling into the gut. And our immune system and all of these inflammatory markers, we see them going up. So why are they really going up? And they are not good for the heart and the cardiovascular system. But again, why are the inflammatory markers going up? What caused your leaky gut? Which creates this autoimmune stress and all of these things going on. And it just started in your mouth. Your mouth is the beginning of your digestive system, right? So all of that is linked to the oral health, and oral bacteria in high numbers getting to the rest of the body. This is what's causing the inflammation to where the markers now start showing up. But we don't look at that. I mean, most of the biological dentist or cardiologist or most of the MDs, they won't at all ask you to open your mouth and show me your mouth if you have a gum disease or anything. The mouth is the first thing, and that's why Prophet Muhammad ﷺ emphasizes on miswak, on cleaning the mouth. And he said in a Sahih Hadith that if it wouldn't be hard for my ummah, I would have made miswak a fard with every wudu. But anyhow, he knew best. So we can do some things which can help people, and they're at home, they're not expensive, and which can help in their cleaning the mouth issue. So there are two kinds of treatments. One, you can do it at home, and the other ones are in clinic, such as oxygen therapy and other kinds of therapy we're going to discuss. So you don't really need expensive toothbrushes and electric spinners or whatever, the ultrasonic brushes you've got there. But if you've got good dexterity, then you can use a manual brush with soft bristles and simple brushing techniques, some flossing, and it really doesn't matter what dentrifiers you use, but don't use the mainstream like Crest or Colgate, because any plaque which controls any plaque controls, because they're very abrasive and they've got a lot of ingredients you don't want in them. And simple warm water gargles or salt water, it's antibacterial and it sucks the water out of the bacteria. Simple, right? And we can all do warm salt water gargles, and there are some good germicidals which are like eucalyptus. You can use other essential oils, and so you can use neem essential oil, clove, peppermint, tea tree, any which is available. And there's a product called ITSAP, ITSAP. I don't know if you've heard of it, but the main ingredient is prickly ash bark, and it's an anti-infective. There are some other ingredients like iodine and calcium chloride, but the main ingredient is the prickly ash bark. It's anti-infective, and most of those oils are anti-infective and germicidal. These are the things we can get hold of, and then we can do it at home. There's another product, Septilin, Septilin, which is a multi-herbal mixture of gojul, guduchi, and licorice. I don't really know how to pronounce gojul, but this is a Ayurvedic herb which helps in cholesterol, reducing cholesterol. Guduchi is another Ayurvedic leaves which is used in asthma and other respiratory problems and tonsillitis. Licorice is also Ayurvedic, and this is used for anti-diabetes. They're all anti-infective, and you can see the link that they are linked to heart diseases and asthma and diabetes. So if you don't want to buy anything, it's simple that you can use warm water, salt water gargles, baking soda on the brush, and it's non-abrasive. The Native Americans, they used to use toothpaste that had neem oil, white oak bark powder. So the white oak bark powder is high in tannins and omega-3, which the tannins, they get really good attachment with your gums and make your gums tight. So one advice is that do not use regular table salt, as it is quite abrasive, and you could rather use baking soda directly on the toothbrush. And oil pulling is another Ayurvedic medicine. So oil pulling is unique in that sort that it came into favor just a few years ago, and most people started with sesame oil, but now they use coconut, and people don't realize that what it actually pulls out, the strep mutans, which are the oral bacteria, which again causes cavity. It strips off the enamel. So honestly speaking, like 5 to 10 minutes of oil pulling with charcoal and coconut is more than enough. Now there are a lot of toothpaste out there with charcoal. I love charcoal. What I don't like are these pastes that have charcoal, bentonite clay, tea tree oil, and there are too many stripping agents in one toothpaste. So you don't need a lot in one. You can just choose one, charcoal or bentonite clay or tea tree oil. And you don't want to take away all the good stuff as well, the enamel and the protectant layer of your teeth. you need them and you need to protect them. So don't overkill on these charcoal toothpastes out there in the market. And when we come to the morning breakfast, so we see one thing, that somebody who was eating oatmeal first thing in the morning, their blood sugar was skyrocketing high as compared to someone who was eating eggs. And it's perfect, like everything is good. The whole protein and sugar argument, we know that protein should be more. But where am I supposed to build the biofilm? You need to build a biofilm around your teeth. There's a connection that too much sugar will cause whiteness on the tongues. It's going to decrease the biofilm. And a carbohydrate-rich day, you can easily check from just scraping off a little bit of saliva from your tongue and from your teeth. That whiteness which comes out shows you that you had a lot of carbohydrates, which is deteriorating your overall oral health. So even if some days, like I'm eating an apple and I go there, take a rubber gum tip or a tissue and I go along the gum line and just sort of clean up, and I pull that tissue to see, and there's a lot of white stuff coming out. That's just a connection of the carbohydrates to your oral health. So another good thing is the hydro floss, which I think everybody should buy it and they should have it in their house. Hydro floss is the best oral irrigator out there, and it has been used for decades. It's incredible. It's a hydromagnetic system where it's got little magnets at the tip that polarizes the water, and it makes it more effective at taking off plaque and stuff. It's absolutely true. And in fact, I think if you take a piece of floss and you go between your teeth, you can get the floss around 2 millimeters down the gum, because the surface nature of your gum is going to stop you. But you can't stop the floss down in a V-shaped way with water. So water is definitely going to make its way and go deep down. So that's the whole thing about hydro floss. And if you put a little essential oil after that, and it might just stick on your floss and then make it go between your teeth, it's going to give a nice smell, and the smell of the floss and other things, the nasty smell, that's going to go. So this kind of the treatment, like putting essential oils on the floss and then putting the floss between your teeth, it's kind of nice, and it can really help keeping those bad gum smelling part go away. But what's the connection between white tongue and the bacterial overgrowth, and how do I see it? So believe me, there is oral and systemic connection. So Chinese medicine, and you know that they use the tongue to diagnose everything. And it's true that if you look up at somebody's tongue, for instance, your children's tongue, and sometimes it has got deep crevice down in the middle, they've got some gut issues going on, tummy aches, and you can test that by looking at the tongue of your child, or even your spouse or anybody, and you'll notice a crevice goes away, the tongue flattens out more the moment you fix their diet or other things. But from an oral standpoint, if people are not brushing their tongue, you need to start brushing your tongue or get a tongue scraper. You have to gag easily. These tongue scrapers are great because they're kind of horseshoe shaped, and you can get back pretty far and pull the stuff off the top of your tongue without gagging. They can be rubber or metal or whatever, and it's not only the top of the tongue you want to brush. So you should be scraping off or brushing also the back of the tongue, and that's not the kind of anatomy you see on the tongue. If you've got tiny projections coming out at the back of your tongue should be clean without any such projections. So we already mentioned the oils: tea tree oil, neem oil, peppermint oil. You can put the 2-3 drops in 30 ml of water, preferably distilled water, non-fluoride water, and here you go, that's your mouthwash. So there's a brand called Oxifresh, Oxifresh, which makes a good mouthwash. It's probably with the thieves oil, and there are other good ones as well, and they've got no sugar in it, so that's the best part about it. Cinnamon is also another essential oil. Now let's go to the other things which your hygienist or your dentist can do for you, and he can use ozonated water as a basic cleaning requirement. And if your hygienist is using her ultrasonics or she's hand scaling and then rinsing, it's nice to add ozonated water, because you're getting that antibacterial effect and antifungal and antiviral effect from ozonated water. So you're cleaning up all different kinds of bacteria or bugs or whatever you call them in your mouth. And cleaning is, first of all diagnosing, figuring out exactly where you are, and then you don't have to be extra aggressive when it comes to your teeth. So, because if you're a patient and you go to your hygienist and you come out as bleeding, so that's not right. So choose your dentist, choose your hygienist who uses deeper cleanings, proper procedures, but not to an extent where they become aggressive. The skills of the hygienist are very important, and the instruments need to be sterilized, sharp and finely tuned. And if he's giving you 40-minute cleaning, so you've really got a 30-minute cleaning, because they need to check every teeth and properly tap it and check it. Now, as a last word on ozone therapy for someone with gum disease, and I can't say enough about ozone, because the obvious stuff that I mentioned, ozonated water while you're doing the cleanings, ozone gas may be squirted under the gum in those deep pockets. There's a treatment that some of the dentists they do, it's called tray therapy. It's kind of neat, where we make these little silicone trays that are fitted to your mouth, and there's an input and an output. And for patients that have really bad gum diseases, this is amazing. It can change things overnight. So you sit them in chair, you put the tray on the bottom teeth, turn on the ozone gas goes into one port, it innervates everything, the gum, the teeth, the whole area, because it sucks down the whole area, and then it outputs to a suction that's on very low. So the ozone stays for about 20 minutes, and then you do the upper tray, do the same thing, 20 minutes, 20 plus 20, 40 minutes, and it's unreal what it does. It's like amazing. So it's the closest thing to panacea that we have in medicine. So gum diseases are in any way reversible, and don't get overwhelmed. It's fair to say that for sure they are reversible, but your bone will not grow back at the age of 50. So you can get some sort of stability and health by probing a deep pocket. I hope there's no bleeding. And take home messages that whether you have a mild case or you're getting advanced, get yourself first of all cleaned out. Go to a biologic dentist, go to a hygienist, get it diagnosed properly, get the cleaning done regularly, and then do these things that we talked about, like simple home things, the essential oils, baking soda, non-abrasive things, oil pulling, and other flossing and hydrofloss. And if God forbids there is some plaque that's still there, and it goes in your arteries, it will go away. as well as you start doing cleaning, do miswak. Start doing miswak. If you can't do miswak, you use miswak powders. There are miswak powders out there. There are Ayurvedic powders out there which you can directly put on your toothbrushes and brush your teeth with them. Keep a floss in your pocket. You can easily keep a floss in your pocket, and wherever you're standing at, you're driving and you're waiting at a signal, take out your floss, start flossing your teeth, and put the floss away, like throw it in a tissue. So you can keep floss in your car. You can keep floss in your office. That's simple to do. And so I hope you have relatively pain-free and bright teeth and good gums coming up. So see you in the next videos, and I'm